Welcome to the interview.
Okay. Alright, well, I'm Brittany Lear, and I've suffered chronic fatigue syndrome for about 3 years now. And so today I wanted to interview Toby Morrison about CFS and what he does for sufferers and for his clients. So, hi Toby.
Hello, thanks for having me. I feel privileged to be here in my own studio.
Alright, what do you do for people who suffer chronic fatigue syndrome?
Okay, so effectively what I do for people who suffer from chronic fatigue syndrome is offer a solution or an exit strategy for people to overcome CFS and regain quality of life and really function in their day-to-day life, because as you know, with chronic fatigue syndrome, it completely robs you of your life, it completely robs you of your inactivity. You can't do the things that you used to love doing because your symptoms are so bad. You're usually bedridden, you're tired, you know, and it can really disable your life. So my job is to help people restore health and function in their daily life on a holistic level, so not just on a physical level but on an emotional level as well. And it's really about rebuilding people's lives so they can get some quality function back into their life and also, you know, live their dreams, because for so long that most people's dreams have vanished because of this illness, and my job is to help facilitate people through that and to make their journey a little bit easier.
Can you explain to listeners what chronic fatigue actually is? Okay,
so chronic fatigue syndrome is kind of complex. It's a multifaceted illness, so it doesn't just affect one area of your life, but really what chronic fatigue syndrome is, in a simplistic way for people who aren't that interested in scientific baffle, what chronic fatigue syndrome really means is that your body is completely unhealthy in the way that their immune system doesn't work, their sleep is deprived, their symptoms flare up. So how chronic fatigue syndrome is diagnosed is that 6 or more symptoms have to persist for more than 6 months. On top of that, you need to exclude any other illness, you know, such as cancer, such as diabetes. So it's kind of serious, and doctors really find it hard to diagnose because there are so much other problems with chronic fatigue. You know, sleep irritability, sleep insomnia. It can lead to secondary depression and anxiety. So there's a hell of a lot of things that doctors need to exclude in order to come to the conclusion that chronic fatigue syndrome is existing in the body. However, it is a neurological disease, and that was classified from the American government ages ago really, but it's only just last year that the awareness is coming out now. So that's kind of good. You know, it's a hard thing because it's an invisible illness, really. You can't see it. Most people look kind of okay on the outside, but on the inside, their body's deteriorating, they don't feel good, their energy's lacking. You know, people can sleep up to 16 to 18 hours a day with chronic fatigue syndrome. So that's just a quick overview of what it is.
What did it mean to you when you opened up the first chronic fatigue centre in Australia?
What did it mean to me? So this has never been done before. So there was never a specific place where someone could come and get specific help with their chronic fatigue syndrome. Sure, there's lots of alternative therapies where you know, they can help with chronic fatigue, but there was no one who actually had been through it, overcome it, and then, you know, said, hey, you know, if you follow these steps, you can also improve as well and get your life back. There's certainly no quick fix, but I remember when I helped my first person, it was actually, it was a next door neighbour's friend, and they heard that I had chronic fatigue and that I'd recovered, and so I practically saw this person once a week for 12 weeks, and within the 12 weeks he went from completely bedbound, could barely walk 1 minute, and this was an athlete, an ex-athlete. Within 12 weeks he was running again and competing at the highest level in Australia for running. And then I just knew that there was something that was there that worked, and I had, you know, some kind of, I'm going to get a bit emotional now, but I had this spark in the back of my back, or in the back of my head, that I knew that something could be done. And so now, like, I've seen over 1,500 people individually with chronic fatigue over 7 years. We've got staff who have seen hundreds of people, and then we've also got over 1,000 people in our online recovery program in 24 countries now, which is crazy. So it's kind of been a bit more than I thought it would be, but yeah, it's very special.
If you could give a piece of advice to listeners who may suffer with chronic fatigue syndrome, what would it be?
without being the coach and taking my coaching hat off, I think it's important just to realise that it's real. You know, I could easily say come and do my program, but that's at a latter stage when you feel you're ready to get the help. I think it's really important that you realise that if you do have chronic fatigue syndrome, it's not all in your head. You're not cuckoo or going crazy. What you are experiencing is very real, and affects over 17 million people worldwide. So the first thing really that helped me the most was acceptance of the illness. Not accepting that I was going to be sick forever, but accepting that this was my situation and circumstances, and really then dealing with what I had to deal with day to day. And that might mean literally just waking up and trying to get out of bed. It might mean starting a restorative movement program. It might be going to see the doctor. But really, it's about accepting where you're at and starting with what you can do, not what you can't do. I think a lot of people focus on what they can't do, and then that's when life starts to lose. So it's really important that if you are suffering chronic fatigue syndrome, focus on what you can do. It might not be much. I mean, for me, it was walking 1 minute a day to start with, and today I've already gone for an hour bike ride, a swim, and I'm in my centre now. I'll probably do a workout later this evening. So once, 10 years ago, I thought that I'd never be able to physically run again.
Yep.
What is the most frequently asked question you get asked by your clients, and what answer do you give them?
Toby, how long will it take till I get better? When will I know? One of the most common questions, which I guess is very normal, is how long is it going to take? How long did it take you? And my answer is really simple. It doesn't matter how long it took me. It doesn't matter how long it takes. It matters that you're on the journey to getting there. And I learned this through the hard way myself. There's lots of times where I just want to speed up the journey and not have to go through the suffering and pain that we experience from day to day in life and also illness. But it's not, if we rush it, if we try and avoid it, it comes back and bites us on the arse twice as hard. I'm sorry if I swore there, but that's true. So what you really need to do is focus on where you're at, what you want to achieve, what you want to get out of it, and put the steps down in place that you can go and do that. I think the worst thing you can do is put a time frame on it, because that just creates a huge amount of pressure. And the second thing is you should never ever compare yourself to anyone else but yourself with your current situation and circumstances. If you look far back, then that's going to make you depressed, and if you look too far forward, it's going to make you anxious and fearful. And I can speak from experience because this is what I've gone through myself. Okay, so it's really important that you don't compare yourself to anyone else. You start with where you're at and aim for 5 or 10% improvement. That's what I tell all my people, not just with chronic fatigue syndrome, but with life. Things seem way too overwhelming, and we disinterest ourselves, or we lose passion and focus because it's all too hard. It's not supposed to be hard. It's supposed to be the journey that it's a long-term plan to get out of something that we don't want to be in.
Well, in saying that, you are also a general health freak. Is there any advice you give to people whether suffering CFS or not?
Yeah,
what would it be?
Cool. So it's funny, most people think I'm a health freak, but I'm actually not. So I do like chocolate cake, so if you see me down the street, you can throw me a mud cake any day of the week and I'll eat it. The thing is, it's balance. I think it's unhealthy to become too healthy. And I think I see this a lot I saw it with myself, but I saw it with a lot of my patients and people in life. I met a girl recently, and she said to me at a cafe, because she knows who I am, she goes, "Oh, congratulations, what you do is great." She goes, "Funny, I was really trying to be healthy last year and I felt really crap. And then I just stopped trying to be healthy and then I felt really good." And it's really about balance. And I talk about the non-diet, which is following a diet plan or a nutritional plan that actually gives you energy and fuels you up. Diets don't really last. Same thing with exercise. It's all about balance, but more importantly, it's about listening to your body. There's, just like the 4 seasons with winter, summer, spring, autumn, there's going to be times when you need to go and put the foot on the gas, and there's going to be times where you need to slow down, breathe and actually restore your energy rather than get too exhausted and push yourself. One of the things I've learned lately is give yourself more. Stop trying to get more out of yourself. In the 21st century, especially young people like you and myself, we try and get as much out of ourselves as possible. Well, what happens there is we completely burn ourselves out. Burnout's just a huge word these days, and stress. So really it's important to, as much as you give, you've got to receive as well. So receive, you know, give yourself that energy, give yourself that love, go and do something you love that gives you satisfaction inside your soul that will give you longer lasting energy.
Last question. When you are not busy running your online worldwide program or your CFS centre in Melbourne, what do you like to do with your time?
Okay, so for the first 5 years of setting this this whole centre and program up, I barely slept. I probably did everything that I tell my clients not to do. But that's what happens when you've got a passion inside your heart that you can't stop. But I learned the hard way. Last year I slowed down a lot. I kind of set my priorities on what's important, not only in my purpose but also in my personal life. And one thing that I've learnt lately is that if you're not well, then nothing else around you will be. So my big focus this year in 2015 for myself is, you know, if I'm well, then everything else around me is well. And that just shows, you know, like, you know, our program is taken off. It's helping so many people. We've got great staff who help other people with chronic fatigue syndrome. But more importantly, we're happy. And I don't mean happy by smiling all the time, because that's not realistic, but I mean happy is in content most of the time. Of course, we can always do more, but in my downtime, I like to go surfing when I can. You know, it's just great to be out in the water without a mobile phone or a computer, which we're all attached to. You know, it's almost like we've got two lives, especially with our online program. It doesn't sleep. There's 24 countries, every single different time zones. Every hour is a different question. So it's just learning to set boundaries. I love the beach. This morning I went for a bike ride and you know, saw 10 dolphins swimming up and down, and I decided to jump off the end of the pier and be a teenage schoolboy again and do a few flips and dives, so that was kind of fun. So yeah, I just like to have a balance. I do like to go to bed early though. I'm kind of a grandpa now. Before 10:30 p.m. is a good time to go to bed because you actually feel better for it the next day. So yeah, sleep and surfing is my two.
Alright, thank you, Toby, and thank you.
Thank you so much.